This is a practice-changing moment in CLL indeed. This study was designed in a randomized, placebo-controlled, one-on-one large international study, as all the bells and whistles that a clinical question can be answered in the most rigorous way. Over 578 patients were enrolled in 2 arms. The study was designed to receive 6 cycles of BR with or without ibrutinib or placebo, and at the time of progression, patients were either allowed to continue the ibrutinib, or at the time of completion of the 6th cycle, patients were allowed to continue ibrutinib or placebo. The primary endpoint of this study was progression-free survival. And as you know, CLL is an incurable cancer. So the premise, or the whole idea of management strategy in CLL is to first get these patients into remission as much as possible, and then try to maintain that remission for as long as possible. And this is what the study tried to do, is to find out whether ibrutinib can add to the existing advantage that BR brings. And we found, our primary endpoint being PFS, or progression-free survival, we found amazing results. That is the only thing I can say, yeah, they're spectacular, and they will change how we will treat CLL going forward from today. So the progression-free survival assessed at the median of 17 months showed that those patients who were on the ibrutinib arm have not reached their median progression-free survival, versus those who were on the placebo-controlled arm have 13 months. And the curves are separating right from the very get-go, where the first evaluation for patients were done, and that's a spectacular way of saying. And the hazard ratio is so significant, suggesting that the chance or the risk of death or progression is significantly decreased by 80% among patients who have received ibrutinib. Now that's just impressive, and that piece in itself is a practice-changing data.